2 years ago, it was COVID-19 that shut down our country as thousands fell ill and overwhelmed our hospitals and healthcare system. Earlier this summer and fall, RSV hit both young children and seniors, and hospital beds again were in short supply. Now the flu is threatening to do the same, and COVID is on the rise again. It's a triple threat, and the respiratory virus season has months to go. How bad can it get, and what can we do to soften the blow? Coming up, we have a panel of experts who will talk about what you can do to stay safe.
Thank you to the Eunice Joyce Gardiner Charitable Foundation for its leadership support of the Health Channel.
Welcome to Triple Threat, Flu, RSV, and COVID Town Hall. I'm Olga Villaverde, and joining me is Dr. Michael Zinner. He is the CEO and Executive Director of Miami Cancer Institute. Dr. Zinner, I wanted to ask you, what would you say is the biggest surprise we've seen during this respiratory virus season?
So, Olga, I was surprised how quickly these respiratory illnesses spread through our population. We knew it was coming. It started with RSV. By the way, that stands for respiratory syncytial virus, but we'll just call it RSV for the rest of the program. Started with children, and then it spread to adults, and now we have both flu and COVID.
And speaking of respiratory illness, I want to show our viewers some important information that we just got from the CDC. It was just released. Take a look at this graphic of the United States and look at these colors. Dr. Zinner, walk us through this. What are we looking at?
All right, so this is a heat map, and what I mean by that is that the darker the color, the more intense the activity. So, for example, if you look at the Northeast and the Southwest, those are very, very dark colors. But they're dark colors all the way through the United States, even down here in the southeast part of the United States.
So we really want to be where those green areas are?
Yeah, I'd love to be there, but that's the Virgin Islands there.
Oh, my goodness. Well, hopefully we'll see green soon. Now let's take a look at another graphic, which is the age distribution of flu. Look at the lines going up. Dr. Zinner, walk us through this one.
Okay, so it's going up the fastest in the senior population, those over 65, and that's the red line, and in children under age 4, and that's the yellow line. And as everyone knows, those two are the most vulnerable populations in our population.
All right, Dr. Zinner, thank you so much for that information. And right now, I want to introduce our amazing panel, Dr. Barbara Mann. She is the acting director of the new CDC Coronavirus and Other Respiratory Viruses Division. Welcome. Dr. Carlos Del Rio is the associate dean of the School of Medicine at Emory University. Dr. Aileen Marty is a distinguished professor of infectious diseases at Florida International University and senior advisor for the World Health Organization. And Dr. Kavita Patel. She's a well-known primary care physician in the D.C. area. Again, thank you all for joining us. Truly appreciate your time.
Happy to be with you.
Thank you. By the way, we just want to remind our viewers, if you have questions for our panelists, please send us an email. We have a whole hour for you at questions@allhealthtv.com. That's questions right there at allhealthtv.com. So we just showed you new information from the CDC. Let's show you some more numbers from the CDC regarding flu and hospitalizations. Take a look at this. The CDC estimates that so far this season there have been 15 million cases, 150,000 hospitalizations, and 9,300 deaths from the flu. Dr. Mann, let me start with you. How do these numbers stack up against previous seasons?
Yeah, that is such a good question. CDC tracks hospitalizations and deaths from flu very closely every year so that we can assess the season severity and let people know. So this year, the flu season started unusually early. Usually it's later in the fall or in the winter. And our flu hospital surveillance system is showing that right now, the number of people that have been hospitalized, the cumulative hospitalization rate since the season started, we count the season starting at the beginning of October, is nearly 8 times higher than what we've seen in the same time period for any previous season going back to the 2010 to 2011 season. And as you said, Dr. Zinner, the hospitalization rates are highest among people over 65, and then followed by children younger than 5. So according to our very latest data, the influenza activity remains high nationwide, but it does appear to be declining in some areas. So at this point, we know for sure that this year's season started early, but we don't know yet whether it will end up being a more severe year. But getting an annual influenza vaccine is the best way to protect yourself against the flu. It helps prevent infection, and it helps prevent serious disease in people who get vaccinated but still get the flu. And it's not too late at all to get the flu vaccine. Now's a great time to get it.
Dr. Marty, as we just heard, this flu season is probably the worst in a decade. Now, what's it like in other countries? Because we've got lots of visitors to come through our area.
Yeah, so travelers are a great way to spread all kinds of viruses. They don't carry passports, the viruses, and also mass gatherings. And of course, there have been some major mass gatherings. We're absolutely seeing a rise in cases now. It really has just started in terms of a worldwide increase. And the type of influenza that's circulating in the world predominantly is a type of influenza A called H3N2, which is also causing 80% of the cases here in the United States. So this travel is a serious aspect of spreading viruses. And I agree with everything Dr. Aileen has said in terms of the risks and the individuals who are at higher risk, which include not only those people who are 65 and older and the young children, but also pregnant individuals, obese individuals, and people with underlying conditions. And absolutely, vaccines are the way to go.
Thank you, Dr. Marty. And by the way, we have a 2-second delay with Dr. Marty, Dr. Zinner, because she's in New Zealand and joining us from there, and we do appreciate her time. Dr. Zinner, now let's take a look at how many people have gotten their flu vaccine so far. This is very interesting. According to the CDC, over 45% of children are vaccinated, nearly 40% of adults, and nearly 45% of pregnant women are vaccinated as well.
Dr. Patel, let me turn this to you for a second. I'm almost afraid to ask this question, but with those kind of numbers, are we facing vaccine fatigue in the United States?
I think, Mike, it's a combination of not just vaccine fatigue, but to be honest, we've got a bottleneck at many of our access points as well. So while these triple viruses, and by the way, it's not just those 3 viruses, there's so many other viruses in circulation. And then after someone is infected with one of these 3 viruses, they can be more likely, especially younger and older patients, to get a bacterial pneumonia, which is a common clinical picture we're seeing. So if you come into any of our country's primary care clinics, urgent clinics, or emergency departments, it is just a madhouse. There's an incredible volume coming through. So it's really hard. I have not been able to have a conversation with a well visit because we're just drowning in sick visits. So if you think about it, it's like all things, multiple factors. Certainly fatigue has set in general, but then on top of that, I think Americans we're very busy, and it's very hard sometimes to prioritize yourself. And in psychology, Mike, this is a kind of a phenomenon known as confirmation bias. If you've been pretty healthy throughout the pandemic, or even if you got COVID and you recovered and you didn't really have any devastating effects from it, you might be more inclined to say, look, I'm not as worried about these 3 viruses because I'll be okay. And I think you're seeing a lot of that effect as well.
Thank you. And I'm going to turn to Dr. Del Rio. So I'm curious what you do in your environment to encourage people to get the flu vaccine. For example, at Miami Cancer Institute, it's mandatory for our staff to have the flu vaccine. I know that's controversial, but we felt that was important for our population.
Well, first of all, thank you, Michael, for doing this very important program. I want to emphasize the value of the flu vaccine because also this year in particular, there's a very good match between the strains in circulation and the 3 strains available, 3 or 4 strains in the vaccine. So getting the vaccine is actually going to protect you in a significant way. And I'm really, really concerned how far behind we are in vaccination. This is really what's driving the increase in visits, the increase in infections, the increase in hospitalizations from the flu. So a lot of us are doing many things. And my health system, like yours, mandates a vaccine, the flu vaccine for all employees. This is not new. We've been doing that for years, and it's been very effective in keeping our employees healthy. But in addition to that, in our primary care clinics, in a variety of different settings, we are making the vaccine easy to get. Now, I will say that the best place in our country to get your vaccine are the big retail pharmacies, whether it's CVS, Walgreens, et cetera. They do a terrific job. In fact, that's where I got my flu vaccine because it's really easy. You walk in, you get your vaccine. So it should not be something that should be a delay in getting vaccinated. I will also say that it is a requirement from Medicare. So if you are a Medicare beneficiary, your hospital will be measured in the percent of patients that get vaccinated. So again, please get your flu vaccination, particularly if you're over the age of 65, particularly if you're a pregnant person. Pregnancy is a very high-risk condition for severe complications from influenza. And, I've seen pregnant women with influenza in the ICU in the past, and I don't want to see that again. It really is terrifying, and it's a very, very severe condition.
And Dr. Del Rio, I'm so glad you said that because I actually walked into CVS to buy some cotton balls, and I was asked, did you get your flu shot? I said, not really. And they said, do you want it? I said, sure. And I got it, and it took less than 2 minutes, so it was easy peasy. So thank you so much, Dr. Del Rio. I have a viewer question. Carolyn is asking, how can I tell if I have the flu or COVID? That's a great question. How important is it to test to determine which virus I have? Dr. Mann, why don't you take that question for me?
Yeah. Well, it can be hard to tell because the symptoms of flu, of RSV, of COVID, and and many of the other respiratory viruses can all be similar and overlapping. It's really hard to tell based on symptoms alone. So it's important to get testing to find out which virus you have, and also to get proper medical care if you're having any warning signs like difficulty breathing or chest pain and so forth. And sometimes getting testing will alter clinical management. There's medications that can be given for people who are high risk for severe influenza or for high risk for severe COVID. And so it really is important to talk to your doctor about getting tested.
Dr. Mann, a quick follow-up, if you don't mind. Is the CDC considering changes to any recommendations? And what about isolation guidelines?
Yeah, we know that COVID-19 is here to stay, and we're anticipating that it's going to, continue to circulate. We see the potential for surges in the virus over the next several months. We've had last couple winters have been pretty bad for COVID-19, and that could happen again this year. So we're tracking this really closely, and we'll keep the public informed. Right now, we're at a different phase of COVID-19 than we were 2 years ago or even 1 year ago, where we have high levels of some amount of immune protection from vaccination, from previous infection in our population. And we also have a lot of tools available now to help protect the general population and also people who are at higher risk for severe illness and for death. So that's vaccines, it's medications, treatments. And so that's why what we're really emphasizing now is the life-saving benefits of those vaccines, and that there's just no time like the present to get vaccinated. Also, we're emphasizing that early antiviral treatment for both influenza and COVID-19 for those patients who are eligible for it can help prevent people from becoming severely ill.
Dr. Patel, let me ask you a question. As I was walking down the halls of my institution today, someone asked me this question, which sort of caught me off guard. With 3 different viruses now active in our communities or more, can you get more than one at the same time?
You can, and certainly we're seeing in hospitalized patients, in our pediatric population in the DC areas, about 4 to 6% of our children who are hospitalized for the flu also had one of the other viruses, COVID-19 or RSV. And in fact, it's something that not just simultaneously, but also thinking about, again, having one virus can set you up for being sick with the other viruses, kind of in a sequence, if you will. It's not common, but it's certainly something to be, if you have, or a loved one, especially a child or an older adult, has had a diagnosis initially, let's say a flu, and then has just had a protracted illness that might have gotten a little bit better and then has gotten worse, it's definitely worth checking in with your healthcare provider to make sure not only could you have one of those bacterial infections I mentioned that can often follow some of these viral infections, but you can also have several different infections. All the more reason to emphasize the role of a vaccine. Mike, it's never too late. I know that a lot of people, I ask that question, look, it's almost Christmas, is it too late? It's never too late. And certainly I'll add in the COVID-19 vaccine too. We've had low uptake of that bivalent booster, which now we've got robust data to show that it's incredibly effective against hospitalization and death.
Thank you, Dr. Patel. Dr. Marty, the number of pregnant women getting vaccinated seems low. Are there any risks with pregnant women getting the vaccine? And what risks are there for them and their babies if they get, let's say, the flu, RSV, or COVID, for that matter?
So we have good vaccines for pregnant women, for influenza and for COVID-19. In general, a vaccine is always going to benefit the mother because she's going to be producing appropriate antibodies, and those antibodies will be transferred over to the fetus and then to the newborn once she's lactating as well. So what you have to consider is that it has to be inactivated or not a live virus. That's what you want to avoid, is a live viral vaccine for a pregnant woman. As long as you're talking about an inactivated vaccine, messenger RNA vaccines are not live vaccines either. And they have now proven their worth in COVID-19, their safety and their efficacy, with no risk of fertility issues for men or women or to the fetus. So they are highly efficacious for the pregnant woman, for her baby, and is going to reduce that risk, both influenza and COVID-19, depending on which vaccine you're talking about. Now, there is a live vaccine for flu. That one should not be given to pregnant women. But the inactive flu vaccine is perfectly safe in pregnant women.
Dr. Patel, let me turn to you on this one. The media has aired a number of reports about drug shortages, especially in children's medications. And have you found that to be the case in your practice, specifically like antibiotics and child's Motrin or Tylenol? And what do you tell parents about that?
We have found these shortages to be a problem. In fact, many of the large pharmacies and big box retailers have actually put limits on the numbers of these medications that an individual can purchase because of these shortages. And unfortunately, we're not in such a severe crisis where there is not enough drug at all in the country. It's a bit of a mismatch, Mike, if you will. So a regional set of pharmacies or stores might not have children's Tylenol or children's ibuprofen. And then you might be able to find it, let's say, 20 miles away. But a worried parent who's trying to deal with a sick child or a sick loved one doesn't have time to do that. So most of what we've been telling people, two things. Number one, children are not little adults. So I discourage people from using adult doses for children because these medications are weight-based and the formulation is such that you should really keep children's medications for them. But then I also offer tips. One, I try to see if they can find a neighbor or someone in their community who might be able to at least give them some of these medications. And then on top of that, especially for RSV, some of the things that work are kind of old-fashioned remedies. We've been able to, with humidifiers and being able to get kind of a little bit more of that humidity, a little ease on the lungs for breathing for young children. And then depending on their age, they can have honey, and that can sometimes be just helpful for a cough. So it's really something that I think highlights just, Mike, how this is all happening at the same time. It really does feel like no matter where you are, you will find somebody who can tell you that they know somebody who's sick with the flu, sick with RSV, and someone else who's sick with COVID as we're seeing those numbers come up.
Thank you, Kavita. Carlos, I want to turn to you on this question, and it's almost a personal question. There appears to be an underuse for the drug Paxlovid. That's the medication that prevents severe COVID. Now, I had COVID a few weeks ago and took Paxlovid and had an excellent response. Within a couple days, the symptoms were gone. But I don't see very many uses of it out in the community. Is that because we have a lower infectivity rate, or because we have a less virulent form of the virus out there now? Or how can you help explain that?
Yes, I think you're absolutely right, Michael. There is a oversupply of Paxlovid and an underutilization, and it's very unfortunate. Now, Paxlovid is not for everyone. You know, if you're over the age of 60, particularly if you're over the age of 65, it makes a lot of sense to get Paxlovid. If you're a young individual, there really is no reason to get Paxlovid. We have very good data for that. So what bothers me is when I hear, you know, the other day somebody called me and said, hey, my 80-year-old parents both got diagnosed with their flu, with COVID, and their primary care physician says they're not eligible for Paxlovid. And what that means is with Paxlovid, there are significant drug-drug interactions. And some primary care physicians, some practitioners are just uncomfortable prescribing the medication. The reality is that the great majority of those drug-drug interactions are very manageable. The most common one is interaction with cholesterol-lowering drugs. And all you have to tell the patients is stop the medication for the 5 days you're taking Paxlovid, and then for about another 5 days after you stop Paxlovid, and you're going to be fine. This was the issue with the two individuals I mentioned to you. When I got on the phone with them and I said, what exactly does your doctor mean that you're not eligible for Paxlovid? And they said, well, they say we're taking this drug called rosuvastatin, and therefore we shouldn't take Paxlovid. I said, let's stop the rosuvastatin and just give you the Paxlovid. So I think part of the problem, Michael, is a lot of, I would say, hesitancy and reluctance from prescribers to use the drug when it's appropriate to use it. So we got to do more education about how to use this drug effectively, because if you get tested and if you're eligible and you start treatment, just like you mentioned, your recovery is going to be very good. The other challenge that we have is a lot of people are uncomfortable about the so-called Paxlovid rebound. And we need to be clear that that's not just from Paxlovid. Even if you don't get treated, you can still get a rebound, a return of the infection. So I like to discourage people from using the term Paxlovid rebound, because it's in fact a COVID rebound.
Yeah, you know, you make some great comments there, Carlos, and I will tell you again, not to take this too personally, but having taken one of the statin drugs, coming off a statin drug for a few days, 5 days, and then waiting a day or two for recovery really made the difference. So it's a very important drug out there, and Olga, I think we need to emphasize, particularly to the primary care physicians, that this is a very manageable deal to deal with.
I'm so glad you both talked about that, because I had even heard from a family member of mine, Dr. Zinner, that they said, no, I can't take it. And I said, no, yes, you can. Go back to the doctor. And they were prescribed Paxlovid. Right. Moving on now, the number of people getting ill is affecting our hospitals as well, Dr. Zinner. Take a look at this. Nearly 80% were filled across the country as of early December.
Dr. Mann, yeah, and it's a hard question to ask because of what we do in the hospitals, but if these numbers continue to rise, are we in for canceling elective procedures as we saw in the heart of the pandemic?
Well, you know, the healthcare system has certainly been under enormous strain. A few weeks ago, especially the pediatric healthcare system, and now increasingly, as Dr. Patel was talking about, the adult healthcare system. So far, the system as a whole has been able to handle the demands that have been made on it. And, you know, our healthcare workers are really heroes. And thank you so much, healthcare workers, for taking what has come your way and making sure that people get the medical care they need. But I think that this situation just emphasizes how important it is for everyone to do what we can to keep from getting sick in the first place. So that means, as I keep saying, getting your recommended vaccines, and then also taking everyday preventive actions like covering your coughs and sneezes, staying home when you're sick, hand washing, getting tested and getting drugs like Paxlovid that can be used to treat COVID-19. I think it's too early to say at this point whether we would make any recommendations about or whether any changes in elective procedures would be needed, because the healthcare system has handled what's come at it. But for everyone to do what they can to avoid getting sick is really important when our healthcare system is under a fair bit of strain.
And Michael, if I may, I would add to that, that as you and I know, our healthcare system doesn't have a lot of empty beds normally. We tend to function at full capacity. So a little bit increase in patients makes a huge difference. And that's why, I tell people in general, you don't want to go to the hospital. Stay healthy, do all the right things. Not only get your flu shot and get your COVID vaccine, but don't smoke, take care of your diabetes. I mean, a success is to not be hospitalized in this day and age.
Carlos, let me stay with you, because a perfect follow-on to that is, when should someone seek medical help for the flu? Like, when should they go to the ER? When should they go to urgent care in this environment?
Well, they need to go get tested quickly, and whether that's urgent care, if you got symptoms and you were asking, can I tell the difference between the flu and COVID? If you have severe respiratory symptoms, you're not going to know. You need to go get tested, and whether you do that at a local pharmacy, at a point station of testing, whether you go to urgent care center, you need to get tested, because once you get tested, you can start therapy. The problem is people wait, and then they start developing complications, and then they start getting shortness of breath. And those are the people that start having difficulty breathing. We ended up seeing in the emergency room, and they get admitted to the hospital. And there were a lot of missed opportunities to intervene early. So even if you get infected, if you intervene early, you can still prevent hospitalization, severe disease. And that's why getting tested and access therapy is really important. So my answer to that, Mike, is if you have symptoms of what appears to be a cold, don't just dismiss it and say, oh, this is just a cold, or this is just a flu. Get tested, seek care, and try to know what's going on, because if you start therapy in time, you're going to prevent the complication.
Carlos, you are so right. In our own hospital system, what we're seeing is not necessarily patients being admitted for the flu or COVID, but the complications they're getting of bacterial pneumonia, COPD, asthma complications. So that's a great point that you're making. Thank you. Now, let me turn to Dr. Marty. I have a question for you. When I was in training, RSV was a childhood disease. RSV now is clearly spread to the adult population, and hopefully now it seems to have peaked. Are we still seeing cases come to the hospital? Can you share with us what you see and whether we anticipate another surge of RSV?
So you're correct that the cases are going down. You're also correct that we're seeing more cases in older individuals than we did in the past. But part of that is that we're looking for it. We used to have these multivalent tests that allow us to rapidly diagnose multiple infections in one individual, and we weren't using them on older individuals. We've been quite surprised at the number of older individuals that have tested positive for RSV. And it has caused significant disease in elderly individuals, which is a new reality, but not necessarily as new as our detection capability has made it appear. So I think that has to be borne in mind. We are still in the season for RSV. We've seen historically a shift in the amount of cases in RSV and the way that RSV is spreading throughout the world in the Northern Hemisphere and the United States specifically. Yes, cases have dipped down, but we're not expecting RSV cases to end until sometime in the early spring.
Wow, thank you. I appreciate that. Let me turn to Dr. Mann about this. I don't know the answer to this one. Is there an RSV vaccine in the works?
There are researchers are working to develop RSV vaccines and also medication for prevention of RSV in infants, but none are available yet. There is a drug that's called palivizumab that's available to prevent severe RSV illness. It's a very small group of infants and young children who are at exceptionally high risk for severe disease. But for most kids, prevention really means those everyday actions: covering coughs and sneezes, staying away from people who are sick, frequent hand washing, and those kinds of, the kinds of things your mother would have told you to do to keep yourself from catching somebody else's germs.
Thank you, Dr. Mann. Appreciate that. Now, we mentioned seniors were also hit by RSV, and they are also at risk, of course, for flu and, of course, COVID. That's the triple threat, Dr. Zinner.
Okay, let's take a look at this video.
One step now, it's all you have to take. You won't fall, I won't let you down. Don't look down, you only have to take one step now.
You know, Olga, seniors usually do well getting vaccinated, but not many seem to have been getting the boosters.
And we were talking about that just earlier. Let's show you this graphic. Almost 94% received their primary series of vaccines, but less than 36% have gotten the new boosters, Dr. Zinner.
Dr. Del Rio, we need a little help here. How can we get more of the folks out there to take their boosters?
Government really has not hired the communication specialists and the people that are out there telling us how to market things, because this is a marketing issue. There's also an availability and accessibility issue. Many people in nursing homes have not gotten vaccinated. So we need to also create some clear guidance and quite frankly, we're afraid of mandates. But you know, just like we mandate or we highly recommend to healthcare institutions to vaccinate their individuals over the age of 65 against the flu, we should do the same thing with COVID booster. People over 65 are the ones that are at high risk of complications, and getting the booster, the bivalent booster, is going to make a huge benefit. This past week, the CDC and the MMWR published 2 articles that showed very clearly the benefits of the bivalent booster. And I'm very concerned that we have many individuals over the age of 65 that have yet to receive their booster. So we have a lot of things to do from healthcare, as professionals, as a society. And the problem is, you know, COVID vaccination has become so politicized that people are, you know, sometimes even doing exactly the opposite. They're trying to get away from mandates. They're trying to say we don't need the vaccine anymore. We're trying to do all sorts of things that I think are going to be counterproductive. So we have a lot of way ahead. And my advice to people is go get your booster. Encourage your loved ones to get their booster, especially if they're over the age of 65. That is the right thing to do. You're going to be happy that you did that.
Thank you so much, Dr. Del Rio. We actually got a question from a viewer, Dr. Zinner, and I just want to read it real quick, and maybe Dr. Patel can answer it for us. Amber wrote in, I can't find medicines for my baby. Can you let me know where to go? She sounds like she really needs that information.
Wow. Dr. Patel, can you help weigh in on this one?
Yeah, I think Amber's unfortunately in an all too common situation. So number one, try to actually reach some of your healthcare providers, even if it's your regular routine healthcare provider. I know it's after hours. We're having this conversation in the evening. So if I would say for the evening, try to find a neighbor or family friend who would at least make phone calls for you while you're trying to also make arrangements to see if your healthcare provider can give you some samples. We're carrying a lot of the kind of over-the-counter medications we generally do, but we're also making sure that we have those available for people who need them. And then the third thing is that if you really are in a situation, depending on what kind of medication you need, to get in touch with someone, a health professional who can talk you through what you might be able to substitute. Remember, I said for children's medications, we do not like to substitute adult medications. But honestly, I've had many scenarios where people think that they have one medication that they must have, and then it turns out that we can also offer some other supportive medications. We just need to be able to give people counsel and advice. So lean on your community and try to see if you can also make an appointment or at least call to the front desk at your local pediatrician or family practitioner and primary care doctor. Many of us are carrying these over-the-counter supplies.
Thank you so much, Dr. Patel. We were talking earlier about seniors not really or hesitating to get those booster shots. Well, it's not just seniors. Take a look at this. While over 44% of blacks got the primary series, only a little over 7% received their booster. As for Hispanics, more than 56% received the primary series, but Dr. Zinner, only about 7% got the booster?
Dr. Patel, those underserved populations close the gap between them and the white population for the primary series of vaccinations. But now, why do they lag getting the boosters? Dr. Patel, any thoughts on that in your practice?
Yeah, absolutely. Mike, I can tell you in just a couple of words, like, we're not trying as hard. I mean, we had a pretty much all out, push out effort. I recall some of my medical assistants holding those spinning signs on the side of the road to try to get people's attention, to show them that they could come and drive through and get vaccines quickly. And a lot of that had to do, by the way, with National Guard and the government and the Public Health Service Corps and a number of volunteer efforts, Medical Reserve Corps, to physically get kind of pop-up tents and vaccine efforts, particularly in communities where we knew, number one, COVID had hit the hardest in many cases, and number two, that disparities to access, meaning it's hard to get any access to healthcare to get your vaccines, were a problem, which is why pharmacy access for COVID vaccines, including for children, has been a lifesaver. But we don't have many of those efforts. In fact, the government has been shifting to moving for the vaccines and treatments and testing that kind of in the near future to really be paid for by commercial insurance, and kind of putting it back in like the traditional healthcare system. Well, we know that the traditional healthcare system has often left many populations of color with severe disparities in other conditions. So it does not shock me one bit. And what I would say to anybody who's watching or listening is that if they know of somebody who's anybody who has not had their booster, kind of building off of Dr. Del Rio, just to let them know that, number one, it's not too late. Number two, that I think not only is it good for you and your health, but the more of us that can get immunized, and building the ability to hold back some of the kind of worst effects of this virus is exactly why we want a lot more people vaccinated. And this extends all the way to treatment as well, that we're seeing those same disparities might play out with access to Paxlovid as well.
Thank you, Dr. Patel. Appreciate it. We have another question from the audience. Alberto wants to know how his dad can get Paxlovid. He just tested positive. Dr. Marty, you want to take this for us?
Paxlovid is available through many methods. They're virtually all the major CVS, Walgreens, Publix, what have you, will be one or more carriers for Paxlovid. Now, unfortunately, it isn't evenly distributed, so not every CVS, not every Publix pharmacy, not every Walgreens has it. But your doctor can link you up with the appropriate pharmacy that does carry the Paxlovid. And of course, you do have to be assured that you're not on any medication that can interfere with it. And if you are, you may have to have a reduction in the dose, or you may have to be off that particular medication while you take your 5 days of Paxlovid.
Thank you, Dr. Marty. Appreciate it. So not everyone who comes down with COVID gets seriously ill. And as this video shows, those cases can be treated at home. Take a look.
Living Minute, a look at the latest medical innovations changing our lives.
Your COVID test came back positive. Do you have to go to the emergency room?
Most cases of COVID actually resolve without needing any kind of prescription medication or advanced care.
If your symptoms are mild, it's likely you can recover at home. You can treat mild COVID like a cold or flu, but you should isolate for 5 days.
It's simple things, getting rest, staying really well hydrated, and sometimes you may want to take a Tylenol or acetaminophen for symptoms of fever.
If you're at risk for severe COVID, there are medications you can take like Paxlovid. And if you start to feel worse, call your doctor right away.
If you find that you're having trouble breathing, you need to get medical attention. Chest pain or pressure in the chest is another reason to stop with the self-care and get medical attention.
Dr. Mann, I want to turn this to you. This is a re-emphasis of what we just heard. When someone does test positive for COVID at home, when should they go to an urgent care center or an ER?
Yeah, I think the video explained nicely the emergency signs. So if people, if you're having trouble breathing, pain or pressure in the chest, the person is confused, can't stay awake. Certainly, if they're have a pale or gray or sort of blue colored skin or lips or nails, those are emergency warning signs, and those people should get medical care right away.
Thank you so much, Dr. Mann. Dr. Marty, let me turn to you. Now that free at-home COVID tests are available to everyone, and no one really has reported the results, do we really know what the incidence of COVID is in the community right now?
No, we're having to do estimates. And not only is that a problem locally and a problem for the United States, it's a problem worldwide. Moreover, it's really serious because we need to know where the virus is more highly concentrated. And we really need to know which particular strains are circulating, which subtypes. Now, and we're down 90% in terms of our sequencing abilities that we had at our peak. That's really dramatic, especially now that there are more than 500 different types of Omicron that are circulating, and the ones that we know are circulating in the United States at high levels are no longer susceptible to our monoclonals. So we're left with molnupiravir, remdesivir, and Paxlovid as the treatment options for these patients, as well as support therapy. So it really is very, very important that we know where the virus is so that we know how to protect ourselves when we are in certain places, with greater emphasis of using those public health and social measures that reduce our risk. Because as everyone on the panel has already said, it's much better not to get sick in the first place. And you can't know where your high risk are unless you know where the virus is concentrated and which ones.
Wow. Thank you, Dr. Marty. Dr. Mann, I want to turn to you on this one. What's the plan going into the winter months to get these respiratory viruses under control? What do you and the CDC want everyone to know?
Well, sounding like a broken record, but first and foremost, we want people to get vaccinated. Vaccines are really effective in protecting people from serious illness, and everyone should get their updated COVID booster, everyone who's eligible, which is almost everyone, and the flu vaccine as well. You can get them both at the same time. It's perfectly safe to get the two of them together. And then there's the everyday actions that I've already talked about a little bit to keep yourself safe. This is the covering your cough, staying home when you're sick, staying away from people who are sick as much as you can. Things like getting tested if you do get sick, so that you can get appropriate treatment if that is recommended for you. So it's that combination of not getting sick in the first place by getting vaccinated, trying to avoid being exposed by those everyday, cover your cough, stay home when you're sick kinds of things, and then getting tested if you do get sick, so that you know what you have and can get treated if it would help you.
Dr. Mann, I wouldn't call that a broken record. I would say that's a really important message. If you take away nothing else from this evening, I think what you're talking about is very important. Dr. Del Rio, let me sort of generalize this a second. Say, we have effective COVID vaccines, a remarkable progress that's been made over the last 3 years. What's the chance of developing a universal vaccine for, let's say, all of these agents? Is that possible?
Michael, there's a lot of research happening for many years about developing a universal flu vaccine, for example. We know that every year as the flu strains change, the WHO has to get together and decide which strains are going to be put into the vaccine for that year. The CDC Advisory Committee on Immunizations then approves the vaccine. So there needs to be, every year, we have to get a new flu vaccine. And some years is good, some years is not as good, because you're guessing what is going to happen out there. having a universal flu vaccine has been really an important challenge for immunologists and vaccinologists, and they're working on that. We also would love to have a vaccine, sort of a pan-coronavirus vaccine, because this COVID is not the last coronavirus we will see. We likely are going to see others. So the reality is, yes, having a pan-coronavirus, beta-coronavirus vaccine will be really, really useful. There's a lot of interest in developing these vaccines. But I will say that part of the challenge, honestly, is not having enough money in the NIH budget to develop the kind of research that needs to be done to develop these vaccines. So there's also need for the government to invest in basic research to make these vaccines a reality in the near future. I think our science is still top notch in this country, and I think we can probably develop those kinds of vaccines going forward.
Thank you, Dr. Del Rio. Many people who have had COVID are still feeling ill with what's known as long COVID. Nearly 1 in 5 adults who had COVID still have long COVID. Take a look at this. The CDC has just released a report that estimates there have been over 3,500 deaths related to long COVID in the first 30 months of the pandemic. Dr. Mann, a couple questions for you, if you don't mind. What group would you say has had long COVID, and are there any new treatments for long COVID?
Yeah, so first, this report shows that long COVID is contributing to deaths. But also the long COVID deaths that were reported in this paper do represent less than 1% of the deaths where COVID-19 was either the underlying cause or a contributing cause. So I think that's important to understand. Most of the people who are dying of COVID are dying of acute COVID. Most of these deaths were in older adults. And we also know that more severe COVID is an important risk factor for getting long COVID. So reducing the risk of long COVID is really one more reason to stay up to date on your COVID vaccines, because if you're up to date on COVID vaccines, you're less likely to get COVID. You're less likely to get long COVID.
Thank you, Dr. Mann. I just got a question from a viewer, and I love the question so much, Dr. Zinner. I'd like to pose it to our entire panel. And this viewer writes, what have we learned after nearly 3 years? I think that's a fabulous question.
So do I. Let's let's start with Dr. Marty. Your response.
Well, I think that we need to look towards the future. We need to get some additional types of vaccines. One of the things that we should be working on, and we are mucosal vaccines. The hope of the mucosal vaccines is to reduce transmission in a way that the current vaccines don't do, and that's and also universal vaccines. So we're working on universal flu vaccines and universal COVID vaccines, which will really make a huge impact. But even now, with what we have, we really should maintain ourselves up to date in our vaccines for those illnesses that shift and change as these viruses do.
Okay, and let's turn to Dr. Patel, and then Dr. Del Rio, and then Dr. Mann.
I'll try to keep it simple. Masks work. I think that there was such a debate in the beginning. Well, it was a novel virus, certainly with coronavirus, with COVID-19, SARS-CoV-2, that there were elements of the virus that were poorly understood, and still, I think, a hesitancy, especially kind of in the February-March 2020 time period, to acknowledge kind of the important role of masks. But we have now had study after study after study that not only illustrates the lives that could have been saved had we had more widespread use of high quality masks, but we have ongoing evidence that can be helpful with the triple-demic or anything. In fact, Mike, you probably have traveled. I recall traveling to other countries and watching them kind of wearing masks as part of their routine habit. I'll be honest with you, I don't think I'm ever going to get on transit or any kind of really congregated public space without one. And it's why I attribute kind of having myself stay healthy despite, seeing incredibly sick patients, because I have taken those precautions. So we learned a lot about some very basic routine things that can literally save our lives. This is, of course, on top of the incredible technology and science, but just some basic stuff.
Thank you so much, Dr. Patel. Dr. Del Rio?
Well, I would say that we've learned on the positive side, we've learned that science makes a big difference, right? Research matters, and we were able to develop powerful vaccines and very effective treatments for COVID in a very short time because we have fantastic science and fantastic scientists in this country. We also learned that unfortunately disparities continue to plague our response to many diseases, and COVID was no different. We also learned, unfortunately, that Americans tolerate a lot of deaths. I mean, I think at the beginning of the pandemic, if anybody had said over 1 million Americans are going to die, people would have laughed. And the reality is that number is true, and we seem to have taken it as a fact of life. And I think that's very unfortunate. We also learned that investing in public health makes a big difference, and the underinvestment we had in public health has really hurt us. So I think there's positive lessons, but there's a lot of bad things that we did, and we hope that in the future we can correct. We got to invest now in public health. We have to make a robust public health infrastructure, and we really need to do a better job as a country to respond to future pandemics, because while this was very severe, this will not be the last pandemic. I finally want to make a comment about the long COVID. I want to encourage anybody who has long COVID to try to find a recover site near where they live. The NIH, the government through the NIH, has established a recover cohort. And the idea is to have this very large group of individuals with long COVID that can be studied, that can participate in clinical trials. And when you say about treatments for long COVID, the clinical trials for trying to find an answer to long COVID are going to happen through the recover study. And in fact, probably the first clinical trial is going to start very soon. Is going to be a trial of Paxlovid, 15 days of Paxlovid in long COVID. So again, if you have long COVID, find the Recover website, find a site near you. There are plenty of sites around the country, and try to enroll in one of the cohorts.
And finally, Dr. Mann, can we hear from you?
Yeah, thank you. And I love the responses that everybody else gave. I agree with all of them. And I'll add just one more from a public health point of view. Is I think we've learned both how important it is and that we can get data out much more quickly and in a much more in a way that's easier for people to understand and easier for people to take action on, and how important that is to give people the information they need to make the decisions that are right for them to keep themselves safe.
Thank you so much, Dr. Mann. We only have a few minutes left, and I have one question from a viewer that I would like to share quickly. And I get it, and I understand, and we've all talked about it as well. How many town halls have we done already in the last 2 years? Many. And we continue to ask this question, but this viewer wants to know, we had heard that this may last 6 months, this may last 1 year. Is this ever going to end? So Dr. Zinner, I'd like your thoughts, and maybe we can have Dr. Del Rio also chime in.
Well, my brief thoughts are, unfortunately, we are not going to see it go away anytime soon, and I think we're going to begin to live with this. I would turn to Dr. Del Rio. We've only got a few minutes left, but I would be curious of your thoughts on this particular question, and then we want to turn to the panel to get their final thoughts.
Yeah, I mean, I would agree with you, Michael. COVID is not going to go away. It's going to become one of the respiratory viruses like flu, like RSV. You know, we're talking about flu, RSV, and COVID right now, and I tell people this is the unholy trinity, right? This is the unholy trinity of respiratory infections that we're dealing with, and we need to learn how to live with these diseases. I love what Dr. Patel said, and I agree with her. I'm not going to be in a crowded environment without a mask going forward. I think we're going to have to learn to live with these new respiratory viruses, but I also want to encourage people to, again, trust science, talk to their governors, and talk to their senators and their representatives about the importance of funding research through the NIH, because the reality is this doesn't mean that we don't have a response. Science will have a response, and I think in the future having effective vaccines, as was mentioned, mucosal vaccines or pan-coronavirus vaccines, pan-influenza vaccines, it's a reality, and research will get us there. So there is a lot of hope as well.
Thank you so much. We've got about only 20 seconds for everybody right now. So Dr. Patel, let me turn to you.
Yes, I'll just briefly say that actions as an individual can protect our community, and what better way to have a great holiday season than to think about the people around you. Keep that in mind as you're moving about over the next several weeks.
Fantastic, and I love that. Dr. Mann, what are your thoughts on this question from our viewer? Will this ever end?
Yeah, and when you think about masks, remember, it's a lot better to be wearing a mask to keep your.
So I'm just going to say what I've said several times: get vaccinated. It's easy, it's safe, it's effective for COVID and for flu.
Thank you so much. Dr. Marty, unfortunately, we ran out of time, but I do want to thank all of you for being here today and for giving us this valuable information. As always, we thank you so much for your time. Thank you. Dr. Zinner?
Olga, I want to thank our panelists. I want to thank the audience for participating with us. This has been a very important session. As we work through the end of, well, this season of respiratory illnesses, I want everyone to remember that we're not going to do this alone. We're going to be able to be with our families. We are going to be able to be with our loved ones. We just need to work through this with vaccines and boosters. They save lives and they help us get through these illnesses. Olga, it's been a lovely, wonderful evening again to be with you and our guests.
It's been a pleasure. Yes, it's been wonderful. And we thank you so much for chiming in and for asking those questions and for joining us as well. As always, we thank you. We ask you to be safe, and we'll see you hopefully soon. Take care.
Thank you.
Thank you to the Eunice Joyce Gardiner Charitable Foundation for its leadership support of the Health Channel.